After 30 years, recently, two of the world's leading authorities on bariatric and metabolic surgery, ASMBS and IFSO, have jointly issued new evidence-based clinical guidelines which expands patients' eligibility for weight loss surgery. ASMBS is American Society for Metabolic and Bariatric Surgery, the largest group of bariatric surgeons and integrated health professionals in the United States. IFSO stands for International Federation for Surgery of Obesity and Metabolic Disorders, which represents 72 national associations and societies throughout the world, including Australia. Over the last 30 years, practice of bariatric surgery was guided by the guidelines issued by the National Institute of Health in 1991. But after more than 3 decades and hundreds of high-quality studies, they recognize it is no longer reflects best practice and lacks relevance to today's modern-day procedures and population of patients. In fact, it was probably long overdue. In the 1991 consensus statement, bariatric surgery was confined to patients with a BMI of at least 40 or a BMI of 35 or more when at least one obesity-related conditions such as diabetes, hypertension, or heart disease present. The new ASMBS IFSO guidelines now recommend metabolic and bariatric surgery for individuals with a BMI of 35 and more, regardless of presence or absence or severity of obesity-related conditions. And that BMI cutoff is set at 30 or above for people with a metabolic disease, mainly type 2 diabetes. The new guidelines further state metabolic and bariatric surgery is currently the most effective evidence-based treatment for obesity across the BMI classes. Studies with long-term follow-up, published in the decades from the NIH 1991 consensus statement, have consistently demonstrated that metabolic and bariatric surgery produce superior weight loss outcomes compared with non-operative treatment. It is also noted that multiple studies have shown significant improvement of metabolic disease and decrease in overall mortality after surgery. Older surgical operations have been replaced with safer and more effective operations. 2 laparoscopic procedures, namely sleeve gastrectomy and Roux-en-Y gastric bypass, now account for over 90% of all operations performed worldwide. Roughly 1 to 2% of the world's eligible patient populations get weight loss surgery in any given year. Experts say the overall restrictive consensus statement from 1991 has contributed to the limited use of such proven safe and effective treatment.